Perceive, process, perform. Do you need inspiration for your practice, or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration. Dr. Jeff Boone is the President, CEO, and Medical Director of the Boone Heart Institute, a Denver-based healthcare organization dedicated to the eradication of heart disease and stroke. He was selected as one of the top 160 doctors in America by Men's Health magazine and listed as one of the 17 top cardiovascular doctors in America for men.
Hello, my name is Dr. Jeffrey Boone. I am a MD physician from Denver, Colorado, founder and director of the Boone Heart Institute, a Denver-based program that is fully and totally dedicated to the eradication of heart attack and stroke. And then we're finding various other vascular entities involved with that preventive strategy as well. Now, the reason we got involved with this process, getting to the heart of the matter of what may be going on here, is that the actual issues of cardiology and preventing heart disease and stroke in America are actually handled quite well in the emergency setting. That is, when people are really sick, we've got all kinds of incredible doctors and healthcare providers, from the emergency rooms and the ambulances all the way through the cardiologists and the neurologists and the cardiac surgeons. And they do a fabulous job. But using a football analogy, and being from Denver, this is like John Elway throwing a fourth quarter Hail Mary. Meaning he's great. You want the best in the world doing this, but oftentimes Hail Marys don't fall in the right hands. You still want your best people doing that, but also the greatest performers in any profession are often quite bored at the early stages of their profession, meaning that most of our cardiologists, cardiac surgeons, hospitals, universities, they're all aware of all the data in prevention, but they're too busy trying to fix things later in life. Also, the reward system, the payer system, rewards fourth quarter Hail Marys. That is, the way we pay for things would be much like telling firefighters, boy, we just love it that you're so good at fighting fires. We're so happy that you can charge into buildings and you have all kinds of equipment to save us, but we're only going to pay you if there's actually a fire. And we all know that from grade school on, we're taught how to prevent fires and to save ourselves before that happens. Very good analogy. When I speak to firefighter groups, they all understand this, and they realize that in medicine, we tell them the opposite, that we're actually only going to pay for fires. Now, cost is not the biggest issue, although all of us have to have healthcare insurance, and we're worried about the cost of healthcare. But most of the most important things aren't even covered by insurance. And if I'm a good insurance company, that makes me a good business. My business is getting out of paying for things. Meaning I don't want to pay for anything that I don't have to pay. Now, that doesn't make them evil. They're just business people as well, trying to make a living and doing what gets paid for. The end game in most of their work is the stock price. They're trying to please investors, not keep you alive and well. So have your health insurance, but go far beyond in terms of really analyzing who you are and what you want out of life. Now, much of America just sits back and lets things get covered, and they live like they feel like living, and they don't really realize that they're shortening their quality of life, and certainly even their original life, by decades at least, and possibly much more than that with many of their choices. So the efforts in preventive cardiology are very important and have a broad basing effect throughout your body. We're spending money on the wrong ends of things. We spend more money to fix things. We could use a third of that money. If they gave me all the money in healthcare, we'd wipe out heart disease. And now nobody's going to do that, and it would be very simple to do. But we have to start at a baseline of effort to optimize vascular health. Now, how do we do that? Well, as you can see from some of the data that's around throughout the world, we're spending even up to $1/3 trillion right now, and it'll move to $1 trillion a year in 2030. The heart disease rate is actually going up. So any other business, you throw $1 trillion at it, which is triple what you were throwing at it 10 years ago, and the incidence of the problem goes up 40%. Any business, that's like being an oil man and drilling nothing but dry holes. If we're spending triple the amount of money in $1 trillion, we ought to eradicate heart disease and stroke, which I think we could do without much skill involved with the healthcare providers utilizing those efforts to reverse and prevent heart disease. Very complicated to put in a pacemaker, to do a stent, to move toward bypass surgery, to save somebody in an emergency room. Very high skill is needed there. To prevent and eradicate heart attack and stroke, I can do that blindfolded and with my hands behind my back. It takes, though, a completely different change, a completely different algorithm and mindset to accomplish that. So how do we accomplish that? Well, first of all, we need to look at who's got the disease, because half of us in North America, and certainly the emerging rest of the world, the Brazils, Indias, Russias, and Chinas that are becoming what America was the last 50 years, they're all going to die of heart attacks and strokes and miss out on the opportunity to enjoy the fruits of their labors. Many things are involved, but at the core of the process, who's got the disease and how do you reverse it, why is it there, and let's get after treating it. Those issues require you thinking outside of the box of your healthcare, because again, your healthcare is designed to fix you when you really get sick, and that's great, and you couldn't be sicker in a better country than America, because we really take care of our sick people, and people get well rewarded to take care of the sickest of our people. The individual must take charge of their health in a very aggressive way. We need to redefine two things. One is what is significant disease, and two is what is aggressive therapy and treatment. Now, as I was growing up in medicine, the term significant often meant painful, ambulances, sirens, blood on the floor, scalpels, very urgent types of care. And that is one form of significant and aggressive therapy. But to me, I have significant cardiovascular disease. And as a low-cost default mechanism, every male in America over 50 should assume that they have cardiovascular disease. Meaning the aggressive approach to save your health is not to deny problems. Especially us men are often very concerned about admitting to any problems. Embrace those problems. As a 50-year-old or older, you need to embrace the fact that you probably have atherosclerosis and it's going to kill you someday, and you need to treat it 20 years before you feel anything. In the same way, blood pressure. We often hear patients all the time, well, my blood pressure was a little high the other day, but it's usually normal. Embrace the high number. The machine isn't wrong. You've just now got more and more higher blood pressure, and the way to be a healthy 90-year-old is to make your blood pressure perfect. Not even just normal. Not even your doctor's recommendations are often good enough. Data continues to develop that shows the lower the blood pressure, the better. The best blood pressure is one to barely keep you standing. And that's what you ought to strive for. Most importantly, that should be accomplished with 10 fruits and vegetables a day, walking and keeping your weight down, avoiding all kinds of other things that might raise blood pressure, but even a medicine if need be. Embrace that, because that will allow you to have risks that are low enough to protect the arteries and the blood vessels. Now, those cost issues and those kinds of aggressive factors are very important as we move forward in thinking about and discussing how we can reverse heart disease. Beyond just looking at males over 50 and females over 60 and realizing that most of those people have plaque, we want to get at that issue earlier. Data from all over the world shows that if you just do nothing and wait for heart attacks and strokes, we've got our great cardiologists doing interventions with PTCA, stents, and other clot-controlling informations, a cardiac surgeon waiting to do bypass surgery. But if you really look at the data, as 100 individuals approach a heart attack, 34 die before they even arrive at the hospital. Unacceptable. Those 34 have had the disease for at least 20 years. Needs to be attacked, and is also related to kidney disease, diabetes, brain disease, dementias, Alzheimer's. All of these diseases are interconnected. The core process of your health is inflammation, oxidation, and whatever organ surges out first to be your problem is just your most genetically susceptible organ. But in protecting any organ, you protect them all. But again, you cannot wait for isolated interventional vascular strategies. You must treat the entire circulation head to toe. There are 60,000 miles of blood vessels in your body. And every day those 60,000 miles need a cooling, purified current of blood floating through your body, healing the blood vessel. Most of us have polluted streams that are surging with currents that are inappropriate during stress. Easy to assess, easy to detect, easy to reverse. Rare people do that, people seeking for optimal health care. Those are the ones that seek that out. So out of 100 individuals that do nothing, 34 die suddenly. Another 14 die as they're getting to the emergency room through the great firefighters and ambulances and moving into the emergency department and getting to the early cath lab intervention with cardiologists. 2 more die in the first 28 days after the event, meaning they're recuperating in the hospital. So 50 out of 100 people are dead within a month of having this event, and the 50 that got fixed by the John Elway Hail Mary approach probably don't return to a wonderful life of playing tennis every day, leading a company, being a great-grandfather. They may be alive, which we count as a medical success, but if they got involved with everything we're talking about here 20, 30 years earlier, they would never have had that problem. And we would be continuing to move on. And our biggest issue would be to figure out, you better not retire at 65, and you better be having fun at 80, and you better be really getting ready to have your life excellent even at 90. And I think that could happen to almost everybody if you take initiative and action. We can overcome, I believe, even genetics, certainly other issues as well. Now, in your healthcare, you're often going to get tests like cholesterol tests. It's hard to believe that this cholesterol test being done in your doctor's offices right now in America in 2016 is pretty much the same cholesterol test that I was introduced to in medical school in the early 1980s. Nothing has changed. Well, I'm being filmed by equipment that has changed since 1980, but your same cholesterol is being evaluated. Now, everything we know about that cholesterol is still important and normal and good. Take it seriously. Your triglycerides ought to be low. Your HDL cholesterol ought to be high. Your LDL ought to be low. In my patients, I like HDL even above LDL if I can't control plaque or if they have a lot of plaque in the arteries. But realize there is an array of at least 100, 200 tests that are well proven that continue to evaluate not only atherosclerosis but vascular health in this way as well. You need to seek out those. But if I'm running an insurance company, I'm not so keen on having you do all those. I don't want to pay for those. You ought to seek opportunities to pay for some of these things for cash. Much of really cutting-edge medicine needs to be moved into more of a capitalistic approach because things could actually be very inexpensive. There's a new blood test that I use that looks at microscopic heart attacks after doing severe exercise. Very important to somebody who might be over-exercising. We have actually found that people who are aggressively exercising, running marathons, climbing Mount Rainier, Mount Everest, those kind of things, that's very challenging, exciting, exploratory, but not actually good for you if you want to live a long time. And this cardiac troponin I is a number that is very obscure in the usual medical community, but you can get it for cash for, I think, about $12. So those are things that outside of even your insurance, seek out individuals who can help you in these areas. The other possibility that's very important is that about half of the people who have heart attacks have normal cholesterol. So I began saying a couple decades ago that it's actually dangerous to have normal cholesterol because you think you're okay. Now, even some people with high cholesterol don't have much plaque, and that's why it's not a very precise marker. If you took the bell-shaped curve of all those that have heart attacks, the bell-shaped curve of all those that don't have heart attack, huge overlap. And only at the very extremes do we really separate the population. What I want to do is separate the population. Now, atherosclerosis imaging allows us to do that. Imaging the plaque, looking inside of the arteries, is something we have applied to a lot of famous corporations. We test the Broncos, the Pittsburgh Pirates, the Colorado Rockies, NFL alumni. We've worked with a lot of groups where we're able to assess these types of evaluations, looking inside the blood vessels. Once you've done that, a quick look at the heart, the electricity. The heart actually is afflicted, as are the blood vessels, by what I call the four horsemen of heart attack and stroke. Plaque, clot, muscle, which includes the valves, and electricity. Those are the four areas of your heart, and they really relate to the entire milieu of 60,000 miles of blood vessel that you want to assess in a very effective and productive way. So finding the heart disease is often requiring you to seek out atherosclerosis imaging. Now, fortunately, a lot of these CAT scans used to be a big deal. Insurance didn't want to cover it. Insurance didn't want to cover it to the point of now you can go to almost any city in the country and get a coronary calcium score for less than $100. Often on Valentine's Day or Heart Month, they'll have a promotion. You can get it. They used to try to charge us $1,595 for an NFL CAT scan in San Diego using the same sort of technology. So these things are becoming affordable. Don't let your insurance decide your health future. Let them decide what they're going to pay for because that's their job, but your job is to seek more in this regard. So find out if you've got plaque. Coronary calcium is a good way to do that. I'm more in favor of the mass screening with carotid intimal media thickness and carotid plaque tests. We offer that often at these big conventions and symposia for the members at a very low cost as well, usually under $100, and that is a cutting-edge way to assess the process. I've got a tiny bit of plaque in my neck. I should view that as a heart attack or a stroke already having happened. The only difference is that that plaque has not yet ruptured or aggregated a clot that might have caused me problem. But seeing that one plaque in my 60,000 miles of blood vessels tells me if I don't treat that now or later, I might die tomorrow or I might die at 80, but whenever I die, it's sooner than I should have. We need to optimize that, and oftentimes it takes not only a lifestyle, certainly exercise, nutrition, weight control, stress management, smoking cessation are critical to plaque control and plaque reversal and longevity and improvement in the vascular system, but embrace real medication. Do not be afraid. Recent study out of Denmark showed people who were scared out of taking these wonderful statin drugs, which all of I don't know, a cardiologist over 50 that doesn't take a statin in America, and if they aren't, they're not very smart. Now, we don't take them because we like the pharmaceutical industry. We like living a long time and protecting our blood vessels. Recent study in Denmark, people who were scared out of taking their statin by some article in a prevention magazine or something, 23% increase in death almost immediately. So embrace the medication. If there are medicines that are perfect for blood pressure. The group of medicines called angiotensin receptor blockers, ARBs, less side effects than placebo. Very gentle for borderline hypertension. So treat everything you can measure and reverse it, especially if you've got plaque. So find the disease, often takes imaging. If you don't have access to imaging, then just assume that the older you are, the more male you are, the more genetic background that you have with uncles and aunts and fathers and mothers dying young or having stents or bypasses or strokes early on, be aggressive. And aggressive would mean, gosh, my doctor told me my cholesterol was good, but I want it perfect. I want LDL below 70, HDL maybe even above that, blood pressure perfect below 110, 120 over 70. I want blood sugar insulin resistant, my waist smaller than my hips. I want all of those, and then you will begin to optimize the cardiovascular health. And if you have more questions about this, call us, the Boone Heart Institute, booneheart.com in Denver, because you could talk for literally hours about all of the things that can be done. And it really empowers you in an exciting way. And even almost the physicians that you're working with, they're so downtrodden with the way the system is. If you are an excited patient about wanting the best, it actually excites them and empowers many of the good ones of them who are still wanting to do the best, but they're so limited by the system. You don't really need cardiologists as much as you need empowered family physicians, internists, and their extenders, nurse practitioner, physician assistant, and their extenders, nurses. All of those people marshaled with these ideas could literally wipe out heart attack and stroke in America, and then we're all going to have fun playing with our grandkids, actually participating and not just watching. Thanks a lot.